So with many organizations continuing to work remotely around the clock, often off a mobile device, the risk of a HIPAA violation is really starting to crank up. And even before this new norm took shape, 70% of the CISOs in healthcare that we work with were already contending that employees are regularly putting sensitive email data at risk. And although the Office for Civil Rights recently announced that they would exercise discretion when enforcing HIPAA, there's really little sign that that sentiment extends the entirety of the privacy rule. So here are 3 tips on what you can do to mitigate that risk. First of all, equip your employees with the tools they need. People are the new perimeter and they need support, especially in a remote environment where impermissible disclosure becomes an even greater hazard. So this might require virtual training or workshops or refresher clinics that keep email security front of mind, or it might require technological tools that work for the user. Certainly, many of the conversations we're now having with CISOs and DPOs revolve around the use of predictive analytics that continuously learns and deeply understands a user's working patterns, so it can not only detect and prevent a security breach, but it allows users to remain productive as well. It's about employees remaining your biggest asset, not your biggest liability. Secondly, encrypt sensitive data. Now, it's not mandatory under HIPAA, but should you choose not to use encryption, certainly be ready to share the results of your risk analysis. I think email encryption is one of the most effective ways to protect ePHI and save yourself the stress and cost of a violation. And with many employees still at home where the risk of sending a sensitive email in plain text remains higher, then you might even want to consider technologies that recommend or even enforce encryption to keep ePHI safe. Finally, automate responses to patient access requests. We've witnessed fines in the millions of dollars for companies who fail to provide patients with copies of their medical records. It's a strict 30-day window, and almost every conversation we have highlights how lengthy and costly processes are and how it's really impacting organizational efficiency. So by automating the process from finding the relevant records and redacting non-pertinent sensitive data through to exporting and sharing reports with patients, there's a real opportunity to eliminate a huge amount of time from the process, but also cut out a lot of unnecessary spend and resource as well.